Urethroscopic treatment, anterior urethra. Urethroscopic treatment of the anterior urethra is calculated to benefit only those cases that show distinctly localized granulomata or suppuration. The unskilled urethroscopist always sees a few reddened or infiltrated spots along the urethra, wastes his time in cauterizing or incising these, and accomplishes nothing. For in most cases, the underlying lesion is a widespread sclerosis to be influenced only by general dilatation. Yet there are exceptional cases, ulcers and granulomata to be cured by cauterization with 20% silver nitrate solution or by the high-frequency current, single suppurating glands to be drained by incision and healed by applications of silver nitrate solution once a week or so, long paraurethral ducts exudating pus and requiring that they be slit to the bottom and then cauterized. Yet the neophyte will not profit by attempting this form of local treatment. Treatment of the posterior urethra. The inflamed posterior urethra usually requires no local treatment beyond the familiar irrigation, instillation, massage, and dilatation. Granulomata may sometimes be cauterized with advantage. The high-frequency spark must be employed for this purpose. Cyst may be punctured by the spark or by the knife, but these treatments often do the patient no good. Treatment of the inflamed verumontanum, interest in which was revived by Swinburne a decade ago, must be conducted with intelligence and caution. Garrity has cured intractable cases by irrigation of the sinus popularis through a small catheter with 1% silver nitrate solution. Rhytina hopes to improve drainage by guillotining the verumontanum with a special instrument. Swinburne has had great success in control of pain and the cure of such sexual irregularities as premature ejaculation and nocturnal emissions by the application to the verumontanum of 20% silver nitrate solution through his posterior urethroscope. None of these methods of treatment should be employed upon cases that can be cured by milder means, notably by instillations. None of them should be persisted in if they prove outrageously painful. Cauterization should not be repeated oftener than once in 2 weeks. Swinburne applies the silver nitrate solution rather lavishly upon a swab and then neutralizes it with salt solution. I prefer to use a swab only slightly moistened with the silver nitrate solution or to use the solid stick. I also employ very sparingly liquor hydrargyri nitratus pure or in 50% solution. Irrigation of the sinus popularis is most likely to be beneficial in cases characterized by painful emissions. But the whole subject is as yet obscure. Cases that one would expect to help often resist treatment, while unpromising ones sometimes improve rapidly.